Good day to everyone. My name is Jerome Marshall A. Cortez, a student from the Medical College of the Northern Philippines, and I'm going to perform the nasal drop. First is gathered all the equipment that we needed, check the medication order against the original physician's order according to the agency policy, and clarify for any inconsistencies and check the patient for an allergies to know the action, especially the nursing consideration, and safe dose range and purpose of administration and adverse effect of the medication to be administered. Consider the appropriateness of the medication to this patient and perform hand hygiene. After performing hand hygiene, move the medication chart to the outside of the patient room and prepare the administration in the medication area and unlock the medication chart drawer. Enter the passcode and scan the employee identification if required, and prepare the medication from one patient at a time. Read the medication administration record and select a proper medication from one patient drawer or the unit stock. And compare the label of the medication administration record. Check the expiration date and perform calculation if necessary. Scan the barcode on the package if required. When all the medication from one patient have been prepared, recheck the label of the medication administration record before taking them to the patient. Replace the multi-doses and doses container in the patient container or the unit stock. Lock the medication chart before leaving it. After leaving it, transport the medication to the patient bedside carefully and keep the medication in sight all times. Ensure the patient receive all the medication at the correct time and identify the patient using the three methods. Compare the information of the medication administration record, check the name and identify the number of the patient or patient identification band, and ask the patient state his or her name, and if the patient cannot identify him or herself, verify the patient identification with a staff member who knows the patient for the second source, and complete the necessary assessment before administrating the medication, and explain the purpose and action of each medication to the patient, and perform hand hygiene and put on a clean gloves. After putting on a gloves, provide the patient with paper tissue and ask the patient to blow his or her nose. If the patient cannot do by his or herself, help the patient to blow his or her nose. Okay, ma'am. Have the patient to sit up. Have the patient to sit up with head tilted well back. If the patient is lying down, tight head back over a pillow, and draw a sufficient solution into a dropper from both nares to not return excess solution to an stock bottle. Then, ask the patient to breathe through the mouth and hold the tip of the nose and place the dropper about the nares about 1 to 3 inches. Still, prescribe the number of drops in the one nares and then into the other nares. Protect the dropper with piece of soap tubing if patient is an infant or child, avoiding touching the nares with the dropper. Okay, the other one. Have the patient remaining in position with a tilted back from a few minutes. Remove gloves and perform hand hygiene. And assist the patient to anchor for the full position and evaluate the patient response to the procedure and the medicine.